the head first. So I'm going to check to make sure her skull is normocephalic. And as I'm doing that, I'm feeling for any protrusions, tenderness, lumps. Okay. None. She's normocephalic. No distortions to her skull. No depressions. No signs of tenderness. Then I also, is it with this, I look at the frontal and maxillary sinuses, or is that a different one?
Temporal artery.
Oh, okay, for tenderness. The temporal artery is right above the ear. And you're just feeling to see that it's regular and that there's does it hurt at all when I press it? Okay, so she has no tenderness, or I could put WNL.
Within limits.
The normal
Within normal limits.
Okay, within limits is if you're driving, it says 50 miles an hour. Okay. All right, let me see here.
Then it says temporomandibular joint.
Okay, thank you. We're looking at the strength of the muscles of mastication. I want you to open and close your jaw. Okay, and then move your jaw left to right. Good. So there's no limitations, no tenderness when she moves the muscles of mastication. Next, what I think is it range of motion of the neck. First, you're looking to make sure the neck is erect, that it's still, it's not moving around. Okay. Then range of motion. So I'm going to ask her, like Simon says, touch your chin to your chest. Okay. One ear to the shoulder here, to the other. I never have any client hyperextend their neck back, because especially with an elderly person, you could cause some vestibular problems. Also with range of motion, I'm checking for the strength of the spinal accessory muscle, and so I'm going to check for the shrug against resistance. Can you move my hand? No, this way. Okay, so the spinal accessory muscle is intact.
Next is the lymph nodes, it says.
All right, okay, very good. Okay, so I'm going to check preauricular, and by the way, what I'm feeling for, sometimes people have an enlargement of their lymph nodes, and normally they should be non-tender, and they should be less than 1 centimeter. So that's what I'm feeling for. So preauricular, front of the ear, postauricular, submandibular, submentum, occipital all the way in the back. Okay. Superficial clavicle. She wouldn't have this on. I'm having a hard time. It's okay. Okay. Deep. Posterior. And then above the clavicles, supraclavicular. And I don't feel any enlargement, no tenderness. So no lymphadenopathy. Okay? I could put a circle through it, no lymphadenopathy. So you're going to have to know where those nodes are, and you're going to have to say what you're palpating. You just can't say I'm checking the nodes. With the neck, we're also looking at the trachea to make sure it is midline. If you work in intensive care and you're dealing with a serious patient, sometimes it's deviated to the left or right, but hers is midline. We also want to check for the thyroid, but before I do that, what have I missed in that area? Oh, you're right. Thank you. Gastric. It used to be the tonsillar, and that's right in this area here. Thank you. Very good pickup. Yeah. It'd almost be better if I had someone who, like yourself.
I can take this off.
All right.
When they're checking those,
I have another shirt on if you want me to take this off.
Yeah. Okay, now it'll be easier. Okay. All right. Preauricular in front of the ear. Postauricular behind where the mastoid process is. Then right below the ear is the jugogastric one that you were telling me about. Okay. The submandibular around the jawline here. At the very tip of the chin in this area is submental. All the way in the back is the occipital. All the way in the back. Then there's the superficial clavicle area here. Posterior. Cervical, posterior. Now deep cervical. And then the last is a supraclavicular. You want to palpate from the beginning of the clavicles all the way out. And I think we got them this time. Thank you. Oh, yeah. Anything else before we do the thyroid? Okay. I find it easier to do the thyroid posteriorly. And let me just explain what we're going to do before I do it. You're going to use one hand, because the thyroid has 2 wings to it. It fits right over the trachea. And so we're going to do one wing or lobe first. So on one side, you're going to press with your hand in on where you think the thyroid gland is. And with your other hand, you'll palpate while they're swallowing. Okay? Then you'll press in on the opposite hand and palpate on the other side. So you're doing one at a time. We shouldn't feel anything. Only thing we should feel is the water going down the esophagus. You shouldn't be able to palpate anything. But you're going to need water because, you know, we don't have much saliva in our mouth. So would you go ahead and take a sip and just hold it in your mouth and don't swallow till I tell you. Okay, go ahead. I don't feel anything. I pushed in with one hand, palpated with the other. Now I'm going to do the opposite. Go ahead and take a swallow and hold it till I tell you. I'm getting my fingers ready. With this hand, I'm going to palpate when she swallows. Go ahead. All I can feel is the water going down. Next, though, just to be on the safe side, I'm going to check her lobes for brewing sounds, just like we did over the carotids. And once again, I'm going to ask her to hold her breath while I use the bell of my stethoscope to do this. If I hear a brewing sound, it's possible that the thyroid is overworking. Someone with hyperthyroidism might have a brewing sound. Use your bell. Just hold your breath. Breathe normally. Hold your breath. Breathe normally. No brewing sounds. Okay? Have we covered everything for that one? Okay, well, if you don't mind staying here, is it the next one, is it the nose, mouth, and throat?
Yes.
Okay.
Wow.
Huh?
That's a good job. Good job.
This is the last one.
Because I also do, but we don't do it here, but I do abdomen and, yeah, but that's all right. Uh-huh. And it was with the breast, because we use models, not the real person's breast. Okay, again, you're going to need to help me out here, but the first thing I want to check is external nose. I'm looking for any lesions, swelling, any distortion in the nose itself by palpating it. Then I'm also going to look to see if the septum is midline. It's not, a lot of people have a deviated septum. We just need to indicate it. The only time it becomes important is if they have to have a nasogastric tube or suctioning, when you want to take that into account. We're not going to put anything down her nose, in her nose. But I'm also going to check for patency, just like we did when we did the neurosystem. So I'm going to ask you to block off one nostril and breathe in. Good, now the other. One is better than the other.
Like a
You're
little sick,
congested,
yeah.
yeah, I can tell. Okay, so I would say, you know, nares are patent, or she has a little bit of obstruction on the right side, whatever. Okay, with my pen light, I'm just going to push back a little bit on her nair. So I'm looking, what am I looking for? I'm looking for any discharge, nasal discharge. I'm looking for what color is the mucus of the nair, and it should be pink. Our nose is a very vascular structure. It should often be pinker than our mouth because of all the blood vessels. I'm looking to see if I can see any external polyps. I'm not going to go digging in there looking. Okay. Okay. Now I also want to check for the frontal and maxillary sinuses. So for frontal, I'm putting pressure here, asking if she feels any tenderness. Down here, maxillary.
No.
Okay. Sometimes when people have sinus problems, just leaning forward puts more pressure on those sinuses. You don't even have to palpate. Next comes the mouth. So I look at the lips, and she has some dryness on her lower lip. I would note that. But I'm also looking at color, which should be pink. I'm looking to see if there's any lesions. And she told me during my subjective that her lips have been dry because she's starting to get a cold and she forgot her lip balm at home. Okay. Okay, next I want to get my gloves back in place. And you said you had a 2x2, 2x2s?
We have 4x4.
Oh. Well, we'll do it.